to start the recording. All right, composition of the blood, total volume, 75.5 ml for every kilogram of weight in the gentleman's and 66.5 in the ladies. Obviously, 7 to 8% of your body weight, and that represents 5 to 6 liters of blood. And obviously, in your body, somebody can tell me how many gallons of blood is that? 5, 7, 8, 10 gallons of blood? Who can tell me how many gallons of blood is that, more or less? I want to know, sure, over there. A lot, a lot. It's a lot. Yes, a lot of gallons. That is correct. Yes, Alejandra said there is only 2 gallons over there. Good for you. Good for you. But it is 1.5 gallons because it's 4 liters, 1 gallon mostly. And so you only have 6 over there. Exactly. Thank you, Hooper, that she was Googling over there. I saw it through the camera. Now, let's go over here. Blood cells make up 45% of the volume. Plasma, 55% of the blood volume, composed of 92% of water and 7% of plasma protein. And exactly what I mentioned a long time ago, see how much water we have over there that play an important role in the blood pressure. Move on, nothing over here before somebody start to ask me. Let's go to the next one. We have some components over here in your blood, and obviously I already give a preview about this in one of the classes. Remember that the plasma protein formed in the liver, I'm pretty sure that I mentioned which particular protein is formed in the liver. Said albumin, and the people didn't understand over there what I was telling in the class, but because we are in South Florida, obviously, say albumin over there. And very important that the liver also produces globulin, that are part of the antibodies in your beautiful body. Meaning, careful with those three, because it's here that I will give you a hard time in this particular chapter. Let's move on, but again, there is not a question over here directly to the PowerPoint. We have some organic and inorganic components, constituent, product, tissue, metabolism, nutri-organic material, electrolytes, and iron. Again, nothing here. Yes, somebody over here say hi, bye, wonderful time. The cellular components, erythrocytes, leukocytes, and platelets. Nope. Oh, what we have over here, Matt Damon. Let me put over here, Matt Damon. This, my dears, is your bonuses. Every test will have a picture. And guess what? This time, I will not tell you which cells are over here, meaning that will be an interesting weekend trying to find out which particular cells are over there. The only thing that I can tell you, my dear precious, is that they are white blood cells, but they are one particular representative of this group of white blood cells, meaning if you want to know your bonus, you need to tell me which particular cell is this one, this one, this one, and this one. Well, you can put that one in the test, and then you will tell me if you had that bonus right, and that will be your 7th question in your favor. Again, I will leave it over there for some of you to take the picture, but it will be in the recording anyways, but this is your bonus. I will put a picture for every test over there, meaning that yes, are 4 tests over there tonight. Very beautiful thing, and you have different particular pictures. Don't worry, Google will help you. Or Alexa. Moving over there to the next one. Compositions of the blood. Careful with this one, my fears. There is a multiple choice in one of 4. In one of the tests, I had this particular multiple choice exactly like that. Moving on to the next. Also, careful with these 2 bullets. Very important, those 2 bullets, because I like to use them with the previous slide in the multiple choice. Okay? Multiple choice 4. Moving on to the next one. Leukocytes and white blood cells. Yes, that is correct. Hoopa, the first 2. this particular two over here, if this one is out, I will not ask you this, but again, I want that you emphasize the range of the leukocyte because there is a question with these particular values. You need to tell me if that person is leukopenic or have leukocytosis, okay? Careful with this one because there is a question regarding that. I always put that question because for me, a nurse need to understand and make the right interpretations of those range. It's important. The question is, Salazar, I will give you a case. I will give you some values, red blood cells, platelets, white blood cells, and then you need to tell me what do you think is the condition of that patient? Is anemic? Is leukopenic? Is thrombocytopenia? Is thrombocytosis? That is the kind of stuff that you need to tell me, okay? But you need to remember, obviously, what are the number values over here. I will go back because we already saw the values for the blood. Is this below this value over here? Is anemic. Is this above of this number? Is what? Polycythemia. And we will go through this particular what definition soon. Meaning that question is to make interpretation. Not everything could be memorization. That is the reason that you are studying for nurses, to help you to interpret it and try to use that information. Meaning again, just this particular value will help you out in that question, but I will not ask you anything else over here. Now, in this one, yes, I decide to use this one. But again, look over here, that value is important. In persons that are cardiac or cardiac patient, this is the number that we always need to check because if that number drops too much, that person start to bleed out, especially because the anticoagulants over there. But this is a multiple choice. It's in one of 4 quizzes. Careful over there. Okay. Moving on to the next one. No. No. I will put this one out. I always like to talk about these fellows because this is the immature red blood cells over there. When a person is losing huge amounts of blood and we don't have an open wound or it's an internal bleeding that we don't know, and we do CBC, and we're noticing that the CBC, that this one is too high, that person is losing blood and we need to find where it is. And sometimes it's not easy to find because the person look apparently fine. But somewhere is losing blood and the responding in to throw away huge amounts of immature red blood cells. Again, there is not a question over here. Hematopoiesis, obviously, development of the process of red blood cells leading to that particular one. But again, not this one. This is more anatomy and physiology. The same thing happens over here. I will not go with this. The 2 stages, I will not go with this, but I will go with this. I mentioned this one in the 3 classes. What is the hormone that the kidney will secrete that would stimulate the production of red blood cells? Here you go, erythropoietin. You remember now, from now on and to 9, erythropoietin. That is the hormone that this particular kidney produces to stimulate the bone marrow to produce red blood cells. Erythropoietin. Obviously, a person that is diabetic and affect the kidneys, he cannot produce erythropoietin, meaning that this is an important hormone for the person that are diabetic. Erythropoietin, meaning careful with that one. Moving on to the next one. Careful with this one. There is a multiple choice. 1 of 4, multiple choice. I like to trick you out with this one. In the synthesis, forget about this. I will not go with this. No. Oh, yes. I like this one. You see over here that is important for the creations of red blood cells, our beautiful folate and our B12. I like to pass this message to the mothers to be in the audience and the mothers that we have already in case that they want to have another kids in the family. These particular vitamins are very important. Obviously, in some of you would take the famous prenatal pill that is very, very small, something like this big. And then the problem with the prenatal pills is that they have a lot of iron and create constipation. Well, most of the mothers to be exactly like a horse pill. That is correct, Carlina. The most thing that the ladies don't know is that that pill not work if, for example, you are going in honeymoon this weekend. Yeah, I don't want to say who, because that pill will not make any effect immediately. To use this pill to take advantage of all the nutrients that the pill possesses, you need to take this pill 3 months in advance. Okay? You can take it every day, but remember, to take advantage of all the nutrients that the pill possesses, you need to take this in advance before you became pregnant. Meaning that if you want to become pregnant probably in August, I would say around April or May, you will start to take that pill. But if you take the pill and want to become pregnant tomorrow, probably most of the use of the pill will be lost. Okay? Keep that in mind. Again, careful with that one. It's a multiple choice. 1 on 4. Multiple choice. Moving on to the next one. This is an interesting particular question that I like to do in true or false. Many students forget this one, that the blood can circulate over there for 120 days and then are discovered there in the spleen, and the elements are basically recycled through the liver. Careful with this one for true or false. Moving on to there. No, I will not go with this one right now. That is basically how the red blood cell can maintain himself. Remember that the red blood cell don't possess nucleus, meaning that the DNA is come from there, meaning that it's an empty cell, so you want to see it. Now, I want to ask you this one. This is a multiple choice. I will do exactly what I do always. I will eliminate the question. I will put a blank, and then I will give you other option that basically trying to answer that particular definition. Meaning, careful with this one, because erythropoietin is also there in that particular slide, but don't confuse this one with erythropoiesis, okay? Careful with that one. This one is out. I will not go with this. Porphyrin, careful with this one, and bilirubin, very important indeed, because many people don't know this, but some of the components of the bile is what will give the color to your stool. Meaning that if for some reason there is an obstruction in the delivery of that bile in the intestine, the feces will be exactly like this slide over here, white. Because that is basically what will give the coloration to your stool. The bacteria in your intestine will break down that bile in different particular solution, and that's basically what will give that coloration to your stool. Okay? Too much bilirubin, everybody need to know that at this moment of the game, that is jaundice, and it's because probably you have an obstruction somewhere in the area of the delivery of the bile in the intestine. Again, nothing over here. I will not ask you this. I saw the test right now. I removed that question. I remove, jump out. Now, careful with this one. There's a multiple choice that goes with these particular bullets. Is 2 or 4. I will change something over there. You need to be extremely careful because there is a lot of details in this particular PowerPoint. Remember that the way how the oxygen is transported in the red blood cell is because make that kind of combination, no? Oxyhemoglobin. And we have an important enzyme inside of the red blood cells that I always like to ask in anatomy when I was teaching anatomy, carbonic anhydrase that held the red blood cell for carbonic acid. Believe it or not, this have a huge importance in the control of pH in your body fluids, thanks to that enzyme. Okay. Again, multiple choice. I think 2 or 4. Yes, 2 or 4. We will see this multiple choice. Moving on to the next one. No, I will not ask you for this one, but it's interesting because this is even a question that we can see in anatomy, but I will not go with this one. In the partial pressure of oxygen reflect the pressure of tension that the oxygen is set in the dissolved blood. That is something that happens. Affect the tendency of the oxygen to bind to the hemoglobin also happens. Meaning this particular bullet, the big one, there is a true or false in one of the 4 quizzes. Okay? The pulmonary oxygen transport over there, I decide to remove this one out. The oxyhemoglobin dissociation curve is something that is very important for us, especially for the nurses to be, because the pressure that we need to maintain in the chest. The only problem is because I have so many pathologies, I decide to remove this question out. But this is something that will hunting you out back in your life. Meaning, even that I cannot ask you this one in the quiz, I will try to do an effort to ask you this one in the midterm. Qué rico, delicious sugar crush. Moving on to the next one. Moving on. This one is out. That was an old question that I did for the other class. Basically, the affinity of the hemoglobin for oxygen is affected over there. The midterm normally have 50 questions, and the one is more useful about this test is not bonus. Let me put it over here, not bonus in the midterm, because I like to see the people sweating. And that is the reason that it's 50 bonus. Sorry, it's 50 question strike without bonus. Yes, yes, yes. For Claudia and company, I will need to bring the entire Amazonas forest to do napkin for everybody that will cry. Now, let's go there. Now, yes, Natalia cry. This one in particular, I decided to do a true or false with this one. Just one. I did it more to close the gap between the different tests to make them a little different between themselves. Just 1 of 4. And they are in my office area. You can pass, Ira. You can pass, you can pass. Plenty of boxes there. Moving on. 1 of 4, true or false, that particular is, bullet. Yes, just that bullet. No, we will talk about this later on. Don't worry about this one. The question is out. Oh, yes, I love this one. Careful with this one. Careful with this one. Careful with this one. One multiple choice. Careful with this one. Okay? No, I don't like to share. Moving on over there. Carbon dioxide transport. Yup. I will discuss this one when we enter to the heart because it's what my interest, and I think that we are almost there, reaching the heart, meaning stay tuned for the next week. In the pre one, yes, just the first bullet, you can eliminate this one. This says there is a multiple choice related to this one and a true or false in another test related to the same thing. Moving on, I already say no. Oh yes, I want this one. Careful with this one. Multiple choice, just 1 of 4. This is how the beautiful enzymes work inside of the red blood cell to make the conversion with water in these 2 over here. Oh yes, no problem. Out. Any other question? Good. We're not. This one, very important because explain the importance of that enzyme that the red blood cell possesses over there. And you ask me why? Well, very simple. Remember that, somebody remember the pH of the blood? Anybody knows? Anybody have an idea? What is the pH of the blood? What is the range? Hooper is over there, 7.4. Anthony, jump immediately the bar over there. Of course not. Oh my God. Okay, Brittany have it correctly. 7.35 to 7.45. It's an interesting pH because if you know by chemistry that 7.0 is the equilibrium, exactly the dot, basically the middle of the scale. When the blood says that is 7.35 to 7.45, it's only that the blood is a little bit calotic, okay? Meaning that, as you see over there, that the blood play an interesting dance to keep that particular range too close, too tight. And how they do that? One of the mechanisms is this one. If for some reason you stop breathing or have a problem with the accumulations of CO2 in your blood became acidic. A little bit acidic because the CO2 levels start to increase. Well, what this particular fellow will do is to try to make that beautiful reaction and start to produce more from this one. If for some reason, if for some reason you have a lot of acid, what they do is to join these two together to do bicarbonate over there. In other words, they try to remove the hydrogen out of the way and sometimes to release the hydrogen when the condition became too alkalotic. Meaning this is a beautiful dance. Depending what happens in the body, it will grab the hydrogen to basically increase the pH or lower the pH if there is a lot of bicarbonate in the area. That's why this enzyme is very important over there. And that's the reason there is a multiple choice with this particular fellow. Moving on. Nope. We will talk about this one soon, but not now. Oh, yes, anemia. And when we have something opposite, anemia is polycythemia. Careful with this definition. You will have a multiple choice with the other ones, but you need to understand that I am pulling out these two sentences to do a multiple choice. Let's move on. You have relative anemia, normal total red blood cell mass, and absolute anemia. This is the other two for the multiple choice. Careful with these two with the previous one. One multiple choice in one quiz. Relative anemia, normal total red cell mass with disturbance in regulations of the plasma volume, or absolute anemia, you have a decrease in the numbers of the red blood cells. Well, this one is by many things. Could be hemorrhage, could be by destruction, so on, so on, so on. This one because there is a problem with the regulations of the plasma volume. What happens over here, you can have a relative anemia because you have a fluid different from blood, or a lot of fluid different from your blood. A lot of IV fluid, a lot of water, a lot of plasma, not necessarily blood himself. But don't worry, we will go over there more about that. The compensatory mechanism to restore tissue oxygenation, I will not go with this, but again, erythropoietin is already there again, very important indeed. One of the most important organs that detect lack of oxygen is the kidneys, believe it or not. And this is the reason that when the kidneys start to encounter lack of oxygen or a huge concentrations of the CO2, this is how the kidney respond. Increase erythropoietin activity to stimulate the bone marrow production of red blood cells, a capacity that a person that had diabetes probably is impaired. Okay, moving on. Mild anemia normally don't show symptoms. Mild moderate anemia, fatigue, blah, 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 blah. Careful with this one. I have a multiple choice with this one. One question for multiple choice. Everybody at this moment of the game need to understand how to identify those patients. Okay? The last bullet, that is correct. Now, moderate to severe anemia. I will not go with this one because I put the question from the previous one. Now, this is a multiple choice. You will see this one exactly like that in 2 or 4 quizzes. Multiple choice, exactly like that. I will switch something over there. Important to understand that. This one is because you have a stem cell disorder. The stem cell is basically the cell that give origin to the other blood cells in your system. And that is a problem because there is a reduction in that tissue. Sometimes it's replaced by fatty material inside of the bones and became fatty tissue. This is a problem because that person probably sooner or later will have problems in the bone marrow as general, and they need to probably have some kind of transplant over there. He's lucky enough. It's a disease of the young or old. Thank God I don't have that one yet. But this is a multiple choice, 2 of 4s in 2 tests over there of the 4. Moving on to the next one. Aplastic anemia, exactly with the previous one. I put basically all the information from the previous one. You don't need to go through this one. You have over there, again, the famous antigens are involved over here too sometimes because we have white blood cells who like to attack the bone marrow like an autoimmune disease that could happen. Again, moving out. The treatment out. Anemia of the chronic renal failure. Yes, 44 out. Failure of the renal endocrine functions impair the erythropoietin and bone marrow. Okay, let me go back again. This one I said out. This one I said out. And this one is also out. Now I start basically in here, anemia, the chronic renal failure. Remember that the kidney in a person that have any of the kind of onset of problem, for example, you can manage with diabetes, high blood pressure. These two fellows can damage the kidney in the long run. If that happens, obviously you will not produce erythropoietin. That will not give you production of red blood cells. That will give you a low hematocrit. That will give you a low hemoglobin level. And who at the end will basically suffer the major damage? Your beautiful heart. This is how this begins. And there is a beautiful fight between the heart and the kidney. And the question is, which organ will fail first? Normally, it's the heart fail first, but sometimes the kidney can fail first, and then everything goes south from there. But we will discuss more about this later. The dialysis is the treatment of choice when we have a person with problems in the kidneys, but also we need to give the famous erythropoietin. That is, for some people, probably remember that it's called EPO. That is the injection that they will put to these particular patients. Obviously, we need to replace the iron and folate and the B12 in these particular persons. 95% of the person respond very well to erythropoietin therapy. That is the good news that we have that one artificially, and we can basically give them with injection to the patients. But again, I will not go with this, not yet. Now, this is a multiple choice question. 1 of 4, multiple choice. Many people don't understand that we mentioned this one in one class that the B12 is something that you can found or can find in the meat. Many people that only take veggies is what I call the veggie people because only have veggies don't have the opportunity to have this particular vitamin in huge amounts. But it's an interesting fact that the B12 not only help you out in the synthesis of those red blood cells, but also help you out with the stress, help you out with your memory. If you have a deficiency in B12, meaning that you have an internal diarrhea because anything that is fat cannot be absorbed, meaning that the B12 play an important role in many functions in your body, especially when you are tired, especially when you are under pressure, like the sun. the B12 can help you out to fight these particular moments of the stress and help you out with your memory, meaning that in a beautiful final week of classes with a lot of tests, B12 can help you out a little bit over there. I have a company. You can call Claudia. Claudia, no, because the napkin company and the B12 company are basically together. Okay, moving on over here. Careful with this one. It's a multiple choice. Cobalamin. Careful with this first group of values. I like to subtract this with the previous slide, okay? Just that particular bullet over there. Low red blood cells, low white blood cells, platelet count will increase, mean corpuscular value, megaloblastic dysplasia over there. A person that is suffering with diarrhea with a long, long time, sooner or later we have a problem with the absorption of B12. And that is a problem because he will develop what we saw before, the famous pernicious anemia. What is very interesting about this, we'll stop over here with this one, is do you remember your axon, correct? Your axon, and you have your neurons over here, and this is how that beautiful axon that is coming from that neuron's body in your brain, that axon have a coverage over there that is called myelin. Myelin, believe it or not, is full of fat. And you need to have B12 to keep that fat going inside of that axon. If for some reason you lose the capacity to absorb B12, that axon start to degenerate and start to show up scar tissue, meaning that a person that goes basically with low levels of B12 for too long start to have episodes of schizophrenia. Okay, moving on over here to the next one. Again, just pay attention to this one. I didn't say that I am schizophrenic, but I am almost there. Now, the treatment, obviously, we need to give these particular vitamins over there. I will not go with the treatments in the quizzes, but there is some person that when they lose the capacity to absorb B12, this is forever. And forever means that now they need to take injections or pills to absorb through the mucosa of the mouth these particular vitamins. Moving on over here. Again, we already see over there, you see the reversibility of the neurology damage is low, but still we need to be extremely careful in situations that you don't have this vitamin accessible for the person. This one, obviously, this is what I call a question that I cannot escape from it because it's the most common nutritional deficiency in your planet, meaning that this is a question that for everybody will see. Meaning, careful with this one, everybody will see it. It's a multiple choice. And the reason for that is because it's me, it's in the final, it's in the midterm, and probably somebody will ask you this one in your board when you are applying for your license, okay? All bullet is a multiple choice. It's VIP because everybody will see it. Everybody. Moving on. Iron deficit anemia, you have the famous pica that this person suffered. And this one, colonychia, believe it or not, you see the spoon-shaped nails. The nails have this appearance in some people. I'm trying to do the spoon, don't look like an alien, but basically like that. Sometimes when you see the finger on one side, you can see the nail that make a tiny depression also in that beautiful over there. Thank you, but I know that I don't know how to make beautiful drawing. Yes, yes, of course, of course, of course. Please, please, please. You can interrupt the transmission with a lot of tears. Okay, moving on over there. The previous one is not coming, and there is one either. That many people suffer what? Constipation when you have a lot of iron. This is the one of the most problematic situation when the person that take prenatal pills or take huge amounts of iron when the problem is iron anemia, meaning that you need to have something that make your stool more easy to go to the restroom. Beware of that. I will jump this one. And we have thalassemia. Thalassemia is a question that I always need to do. It's in 2 or 4 tests, multiple choice, exactly like that. I always change something inside the bullet, meaning that the question and answer is there. And some situation could be all of the above, or sometimes I will change something very crazily inside. Who knows? Who knows? Who knows? Who knows? Who knows? Moving on to the next one. Nope, this one is out. This one is out too. Sickle cell anemia is there too. It's 1 of 4. Multiple choice. That's the beautiful thing about these 5 chapters. I pull a question specifically for one test, not necessarily for the other. And this is one of these questions that only will show up in one test. It's a B, C, D, E kind of scenarios because I basically splitting some of the sentences over there. I add something else from some other slide, but this is a multiple choice. It's interesting that this defect make the cells difficult to pass through the tiny capillaries over there. That's why this person suffer a lot of pain over there too. Yes, yes, causing pain. I love it because if they don't suffer pain, they don't want to see me. If I don't see me, I cannot charge. That is a reality of this business. Moving on over here to the next one. The crisis, this is the other bullet that I put out from here to put it in the previous one. Careful with this one. In some situation, this is the treatment of choice, but that is not an easy and accessible treatment because this is a lot of money. What they can do sometimes is to clear out like a filter, like some kind of dialysis when they filter the blood to remove this particular cell that had the defect. Okay, but if there is the money, there is basically the influence. That would be the treatment of choice over there. But again, I don't ask you these two. Just remove this one to put it in the previous one. This is another multiple choice. It's in 2 or 4, exactly like that. I didn't change anything. I just changed something over there inside of those bullets. A, B, C, D. Hereditary spherocytosis is a defect in the membrane skeleton of that beautiful red blood cells. And obviously, with after metabolism, autosomal dominant trait, meaning that there is some implications of the sex chromosome over there too. Red blood cells are fragile. Basically, they can be destroyed very easily when they pass through the body over there. Concentrations of the hemoglobin tend to be a little bit increased. Careful with this one, multiple choice. Nope. Yes. This is one of my new questions for this session. The famous glucose 6-phosphate dehydrogenase deficiency, the interesting disorders, meaning that this is part of the multiple choice, meaning all these 2 bullets are coming in that multiple choice. Again, it's a genetic disorder that make the destructions of the membrane of the red blood cell, that is the most common, do not have hemolytic anemia unless challenged by drug or infection. Careful with that. These particular 2 are joined with the next one. Careful with the treatment and the prognosis. I would basically did the multiple choice with these 2 also. Multiple choice, I think this one is in 2 or 4, meaning there is a 50% chance that somebody will see this question. Moving on over there. As you see over here, we had the famous hemolytic disease of the newborn and told you that I will make a questions about this one. If we mention this one in the class, meaning that I will ask you something, but not from this one. Not from this one, is basically what we saw before. Nope, this one is also out. The trip out. The acute blood loss, there is a question. Every nurse needs to be prepared for these kinds of scenarios, maybe for trauma or secondary disease process. I need to tell you that majority of the time is because trauma, like what you will see in the hospital, but there is a possibility that that patient over there in the bed of the hospital will show up with a secondary. See, for the previous one, yes, because what I want from the hemolytic disease is coming from the other chapter. Chapter 10 is one from where I put it out over there. Chapter 10 is the from where I put erythroblastosis fetalis out in the question, not from this particular PowerPoint, okay? But this one, yes, this is a multiple choice, 104. You ready? We're reaching to the 70. No. Uh, we will see these abnormalities later on with heart. That's why I don't have any interest to show you this one in the quiz. Remember, it's only 30 questions. I wish that you would let me to do 150, but by that time, probably Natalia will wait for me with some kind of machine gun in the parking lot and Nurka waiting to help her. Now, we're on with the next one. No, nope, nope, no. You see over here, there is something that sounds like a little bit repetitive from chapter 10. Remember that a person needs to do a cross match before any kind of transfusion. And even with that, some patient will show up with reactions to that blood that you are putting to that patient. Mostly, the most, I would say, common sign or symptoms of the patient that receives blood is that they feel tired like hell, like somebody hit them with a truck. And it's because the adaptation that they need to have with that excess of blood that they receive suddenly over there. Okay, they have like another I would say burden inside of their body. But I will not go with this one. You have two serious complications of it. See, acute lung injury, transfusion, blah blah. But I will not go with that. But now this one, yes, I want this one. Let me clear out. I will ask for this one. Remember, if you have polycythemia, it's because you have an increase in amounts of red blood cells. If you have a person that is beyond 6.2 millions of red blood cells over there, about liter over there, it's important to remember that you need to assume this, that that person is suffering what? High blood pressure. And why I do that assumption? Because if there is more blood, you have more viscosity. More viscosity means that the blood is more viscous, obviously, and more work the heart needs to do. And how the heart can move the blood, increasing his blood pressure. That is a problem because we need to basically manage this particular situation in this particular patient with donations of blood. He needs to donate blood. Now we need to have clear that the polycythemia in this particular person is for a cause that is not another abnormality in the blood. For example, leukemia or any kind of tumor in the bone marrow. We have persons that are polycythemic, if I want to say it like that, is because they overproduce, because they have some kind of alteration in the transmission of erythropoietin, and the red bone marrow is producing constantly huge amounts of red blood cells. But in this particular situation, that is something important. Also, if the person already have high blood pressure, because already have polycythemia, it's not going over there to tell to the first blood truck that you will see over there with 2 tickets for the movie theater to immediately start to donate blood over there. A person that is having high blood pressure for too long and suddenly you remove huge amounts of blood, he can pass out and in front of you. Okay? Well, if you have high blood pressure, Alexandra, but you don't have polycythemia, it's because probably you are in the night shift working in the hospital and that is messing you up with your system. See, you have anemia over there and blood pressure, we need to investigate what's going on over there, what kind of tension is going on over there. Okay? Polycythemia, yes, is part of a multiple choice. Don't worry, we will discuss these particular topics in class. There you go. This is another multiple choice. You will see it. There is different questions about this particular bullet in the quiz. I will say that is two. I will put three because this polycythemia will show three or four in the quizzes, multiple choice related to that. Neoplastic transformations of the bone marrow stem cells, increase of the red blood cell mass, leukocytosis, thrombocytosis. I don't need to tell you that a person that have a lot of thrombocytosis can form thrombus and basically have a sudden cardiac arrest or heart attack over there because of obstruction. Remember that this is a cardinal points over there, the signs of symptom for the increase in viscosity. But as I said before, never pull out huge amounts of blood or make a person donate blood that has been with a high blood pressure for too long. You can keep that guy. Yeah, I will explain that when we reach the heart. The treatment, you have it over there, but I will not go with this. Reducing the increased blood volume, decrease the viscosity, the red blood mass, so on, so on, so on. Platelet count with phlebotomy, meaning that this person needs to put blood now and then, but I will not go with that. We have the secondary polycythemia. This is the one that I am referring to. And this is a person with increasing erythropoietin, and the reason for that is because have a chronic hypoxemia. Uh, What kind of patient you will see with this? A patient that are smokers. Patient that are a smoker already have some kind of conditions in the heart that we already call COPD. For some of you that already did the discussion, and the COPD making possible for the body to expel of the CO2. If you don't expel CO2, you cannot grab oxygen either, creating that hypoxemic condition in the body. Who make the interpretation there is a lack of oxygen over there? The kidney. And the kidney immediately start to release the beautiful erythropoietin to stimulate the bone marrow to produce more red blood cells. The reason for this, more red blood cells, more viscosity, more blood pressure is what you see over here. If you have a person that already have a cardiac problem, that increase in the red blood cells can kill this particular patient. That's why we need to make sure what is the underlying conditions over there. Normally, I see it in smokers, but that could be something else, not necessarily that. You could be a person that have a cystic fibrosis, for example, have a problems in the lung itself or in the respiratory system. Okay, but it's coming. It's another multiple choice. 104. Moving on to the next one, the causes over there, I will go with a relative. Careful with that because I don't want confusion between what is the malignant, what is secondary with the relative. Careful with that. Meaning that I will put over here just this first bullet over here to make sure that the people don't mess up. And then the treatment, I will not go with this. And chapter 13 is already done. Okay? Meaning that you see over there, the chapter was too long. That's why I can cover just three. The other two chapters tomorrow are not so extensive. Let me see something over here. Okay, important next week. For the classes on Monday, I will extend again another half an hour for the class. Remember that we still need to cover some of the time that we need to cover for the holiday that is approaching. Okay? It's important to know that because some people forget about that, have some other issues, and cannot stay in the class. Make sure be prepared to another half an hour. The quiz is on Monday. Yes, it's on Monday for the Monday class and from the evening class and for the class on Tuesday. Okay. Has some person that still owe me some makeup. Make sure that you are prepared to take two tests during the week. If there is another question, just let me know. I will